My mother has Alzheimer's dementia. I lived 800 miles away. I sold my house and I moved back home to take care of her full time. And so I've been doing that for the past 3.5 years. I realized I can't do this by myself. And the caregiver journey can sometimes be a lonely one. I heard about the program through a friend from church.
So when we first touch base with the caregiver themselves, we like to ask, how are you? Because they're not being asked how they're doing. When I ask them that, they're like, wow, I don't think anyone's asked me that. How am I doing?
What surprised me the most is that there's no manual for this. You learn as you go. And so I was extremely happy to become part of this Caregiving for Caregivers program because they give you a lot of the tools in order to be a good caregiver.
When they have very complex tasks that they're needing to do, such as wound care, learning machines, oxygen machines, feeding machines, things like that, we help them identify supports and people that can train them.
Having their name in the medical record is important, especially when it comes to making medical decisions.
Very easily, very accessibly in the chart so that anyone can see who the patient's person is, who their primary caregiver is, their primary helper. And that can be a family member, it's often an adult child, it's often a spouse, a partner.
I worked with Nisi as my counselor, and I met with her over 4 sessions. And that was a very good time for me to be able to decompress, get rid of a lot of stress, and just talk about what was going on with me.
I found in working with Kim and many caregivers, listening is something that they need someone for, because sometimes they don't have anyone to call on or to even, talk to about their caregiver journeys.
And sometimes I have to just let it go. If she wants to wear a sundress out in 20-degree weather, sometimes I just have to put on an extra sweater for her to go outside and be okay. Those are the kinds of things I have to just let go.
So we've seen that when the caregiver takes time to care for themselves, to set some of these things in place, the care recipient tends to do better as well. As part of an age-friendly health system, we're really supporting caregivers in identifying what matters, what's most important to them, and spending that time to identify those things one-on-one. Caring for Caregivers was started in 2019 because our colleagues here at Rush saw the need for support for individual caregivers, that they needed one-on-one support.
Every one of us eventually will be a caregiver, will need a caregiver, and frequently for most of us, these kinds of cycles will happen more than once in our lives. At Rush is really important because it's the first time that we have explicitly funded a project to bring together age-friendly health systems and the support of family caregivers through the 4 M's of best practice care for older adults. The team at Rush is stellar. The team already really, truly, and naturally understood the age-friendly health systems movement as it's become, and was really eager to look at the ways that those 4 M's of best care for older adults apply to caregivers who are the backbone of care for so many in this country, in particular so many older adults. I often say you can't have an age-friendly health system if you're not supporting family caregivers. You can't have an age-friendly health system if you are not working to improve serious illness and end-of-life care. And so those are some of the ways that the programs we operate overlap.
Our program is open to anyone in Illinois. Any family caregiver who's interested in this program, we would encourage them to reach out to us. We will provide the complete assessments. We will get to know them, get to know their individual needs.